The Nigerian government has banned the sale of bushmeat as a precaution to stop the spread of monkeypox. It comes a few days after the Center for Disease Control said that 6 cases had been detected this month alone. This brings the total number of confirmed infections this year to 21, with 1 death. The Ministry of Agriculture also directed vets and its other officials to increase surveillance aimed at detecting any possible cases of monkeypox in animals.
Well, joining us now to help make sense of this development is the Director General of the Nigeria Center for Disease Control, Dr. Ifedayo Adetifa. Thank you so much for joining us on Newsnight. Great to see you again. Let's begin with the controversy around this outbreak of monkeypox, because as we've been told, this is actually with us year in, year out, but this time around there seems to be a lot of controversy around it. Russia had claimed that the US has biolabs in Nigerian cities. To be specific, they mentioned Abuja, Lagos, and Zaria. They say these labs are responsible for the spread of monkeypox. What's the Nigerian government saying?
Thank you very much for having me here. I'll start off by saying really there is no controversy about monkeypox. We have a situation where, because monkeypox is making the news elsewhere, it's beginning to sort of drive a narrative that suggests that there is a crisis or something going on. As you earlier alluded to, we have been seeing and reporting monkeypox for years now. We have been publishing our reports and updates on monkeypox on the NCDC website long before I even arrived and assumed office in this role. The natural history of monkeypox is that the first case was detected here in about 1971, which is 1 year after the first discovery in Congo, DRC, in 1970. And we had cases, and then it disappeared for 40 years, and we had what was an outbreak in 2017, because we had tens of cases and against a period when there was none. But since 2017, we've had cases, what we call sporadic cases, every year till date. And we continue to respond to it alongside other things. As I said somewhere earlier, our priorities for responding to diseases that fit into our mandate have nothing to do with the news headlines. Whether they are sexy or they are in the headlines or not, we respond to them. And now, in terms of the second bit of the allegation, which really hasn't come through official channels, the short answer is that there is no evidence of that. It's falsehood.
Yeah, but when you say there's no evidence of that, it's falsehood, are you just waving off the allegations by Russia, or has the NDDC independently investigated to check the veracity or otherwise of these claims coming from Russia? And would like also, I mean, for the benefit of those who don't even understand exactly what monkeypox is, maybe you want to help us understand what it really is.
Okay, so we're not waving off the allegation as NCDC. As I said, it's not an official communication from the Russian government, so perhaps appropriate agents, foreign affairs or agencies of government cannot respond. But from the perspective of NCDC, we have looked, we are responsible for the network of public health laboratories. All of these laboratories, we are aware of what they do and of course the nature of support that they receive. We collaborate obviously with lots of governments, US, UK, Japan, Korea, and actually even recently spoke to the Russians about vaccine manufacture for COVID. So as long as it's in the interest of our national health security and public health, we are happy to cooperate with anybody who has something that may benefit us. Now, back to the question about what exactly monkeypox is. So monkeypox is a disease that we describe as zoonotic. Zoonotic means that it's caused by a pathogen, in this case a virus, that can infect animals and infect humans. What typically happens is that this virus exists in animals, and there is a spillover event into humans. And when a spillover event happens into humans, you then have the opportunity of humans then transmitting to other humans. Now, what is known historically is that the type of monkeypox virus found in our part of the world, which is also called the West African clade, is not very good at transmission between humans. That's what we call human-to-human transmission. Again, as you may know, monkeypox has another clade that is called the Central African clade or Central African type, which is more common in central parts of Africa. That one is a bit better at transmission between human beings and also tends to cause slightly more severe disease.
Okay, so let's talk about treatment and prevention as well as fatality. What's the fatality ratio for? How dangerous is monkeypox? And you had said earlier that the Nigerian government is trying to access vaccines. How far have we gone? And what's the quantity of vaccines? Would this move the needle?
Well, monkeypox is, typically is rare, mild, self-limiting disease. Now, in a few cases, you can have severe manifestations and you can have the occasional death. And that's not to trivialize deaths, because that's 100% loss for the family that is affected. But what we know is that you tend to have less than 10% of cases in general that may be fatalities. This is much higher with the Central African clade. So far this year, we are reporting, 88 suspected cases, 21 of them confirmed as truly having monkeypox, 6 cases in this month, and overall 1 death. And this 1 death, unfortunately, happened in a patient with immunosuppression that's had compromise of the immunity, underlying problems, and was on immunosuppressive treatments. And we know that immunosuppressive states can be a risk factor for adverse, more severe disease, and indeed adverse outcomes like death for monkeypox. Otherwise, for most people, it's a self-limited illness that they might not even pay much attention to, or just mistake it, for example, for the more common chickenpox.
Vaccines.
Okay, vaccines,
okay.
yes. I mean, how soon are we likely to get it? We heard Nigeria is in collaboration with the WHO and, other...
These conversations are ongoing,
right,
and we cannot provide a timeline at the moment as to when to expect the vaccines. As you know, the existing vaccines are actually small stockpiles, national stockpiles in a few countries, reserved for people that were put together for people at the highest risk and all of that. So there's a bit of discussion at the moment to find out actually what's the size of the respective stockpiles. In addition to that, what's the likelihood of getting the manufacturers to be able to scale up vaccination just in case it's needed. And of course, we are interested, in addition to sort of general public health safety measures, we are keen to get those medical countermeasures, which is vaccines and treatment.
I'm glad you talk about that, because I'm wondering how stringent Nigeria's biosafety measures are, and what kind of measures do you actually put in place that disease outbreaks don't get out of hand. Maybe you want to enlighten us on some of those measures.
I think those are two separate concepts. Disease outbreaks in nature are not under your control. So we are tasked to detect, to prevent. So yes, we anticipate some. For example, the whole list of diseases that are listed as priority diseases, either because they are reimagined or they are epidemic prone and all of that. So you watch out for them. You ensure that you have diagnostic capacity for them, and not just have diagnostic capacity, that you are able to handle and diagnose in the labs that have the appropriate facilities to do that. At the moment, monkeypox is only diagnosed at the National Reference, NCDC's National Reference Lab in Abuja. And we have all that we need in that lab to safely undertake diagnosis of monkeypox. But the same thing applies to everything else, Lassa fever, even COVID. Interesting thing is that all of these conditions are all zoonotic. They're all primarily in animals, and then they crossed over to human beings, and to varying degrees they've now established or become very good at affecting human beings. But we all have the necessary biosafety level containment in the respective laboratories to safely handle them. Now, in the terms of biosafety in general, which relates to safety of biological agents in sort of human health, or well, actually animal health, but human health, we do have some guidance in place. There's a national biosafety and biosecurity action plan. There are several agencies that are responsible for responding or regulation in the biosafety space: Office of the National Security Advisor, the NCDC, the National Biosafety Authority, and others. And yes, so
I have to let you go very quickly, because I was just going to commend the NCDC for the work you've been doing. And in a time where you have a global pandemic such as COVID-19, you're dealing with Lassa fever and now monkeypox, how stretched are you as an agency?
We are stretched. We are very busy, and we are always on the lookout for as much help as we can get. And of course, when we need to, we can get additional. We can increase capacity by hiring such staff.
All right.
Well done.
Ifedayo Adetifa, DG, the Director General, of course, Nigeria Center for Disease Control, NCDC. Thank you so much.
Thank you.